We're turning to other domestic issues now, and here in the studio, our next question comes from John Pardee, a retired accountant from Indianapolis. Mr. Pardee, what's your question?
Do you believe that reform of Medicare and Medicaid is necessary for future deficit reduction? And if you do, how would you propose to do it?
And I believe that question goes first to Mr. Murdock.
Thank you for the question, a great one. And let me break it into the two parts. From the Medicaid perspective, certainly the Medicaid program that is out there today is something that is problematic given its huge cost. You know, I support something that I'm proud to say a fellow Hoosier, Todd Rokita, has presented to the House of Representatives, which is a new bill that would allow states to have flexibility, basically giving block grants to the states. It would freeze Medicaid spending for 10 years, but give the states greater flexibility in administering those funds. It's estimated that would save $1.4 trillion over the next 10 years. To Medicare, as I said before, I absolutely believe that there is a fundamental social contract that government makes with its citizens. And those citizens who have worked most of their working lives with the understanding of what Medicare was going to be, that it would be there, I believe that has to be honored for those over the age of 55. However, I do believe, as with Social Security itself, we have to start setting a different set of expectations for those who today are between the age of 50 and 55 and 45 and 50, 40 and 45 and so on. It is immoral to make promises you cannot keep. And with the escalating cost of health care, especially because government is taking a larger and larger role, we cannot keep those promises. What we have to do instead is provide a way that Americans have greater access to health care savings accounts. They need to have wider contribution limits, and everything they put in those accounts should be deductible, 100%, including health care insurance costs. We also need to have a health care system that allows for state crossing of lines by insurance companies. We need a health care system that will have more pools for insurance purposes, so there's greater economies of scale. And last but not least, we must repeal Obamacare because it would be disastrous for health care in this country.
Mr. Luger, 2 minutes, please.
Well, I have general agreement with my friend on points that he's made. I would compliment, in addition to Congressman Todd Rokita, Mitch Daniels, our governor, for some time has felt that the state of Indiana could better administer Medicaid for a variety of reasons, which he has illustrated at least in his plans and in his speeches. I certainly agree that with regard to Medicare, and I think the Ryan plan brought this to the fore, that the 55 and over situation is probably a reasonable division line, and that the planning for those that are under 55 needs to begin immediately, because we really cannot afford the escalation of the costs of Medicare. And when we talk about budgets and about deficits, but when you consider that Social Security, Medicare, Medicaid, and the defense budget are roughly 70 to 75% of the whole budget picture, there really has to be action taken in each of these areas. And this is a good time to consider the Medicare situation. I agree completely. Obamacare should be repealed so that we do not have interlocking problems with the rest of that, and that we move then toward these markets in states, toward insurance that can be offered across state lines in a much more competitive insurance market. I believe these are extremely important situations that lie immediately before us, and perhaps, depending upon the Supreme Court action, we can move on this much more rapidly.
Mr. Murdock, do you have a rebuttal?
Yes, I'd just like to add a couple other things. As I've talked to literally dozens of doctors around the state of Indiana, the thing I hear overwhelmingly is, again, how the regulatory environment is keeping them from seeing patients. If we had the federal government reducing its regulatory environment in health care, instead of seeing 40 patients a day, doctors might be able to see 80. We also need to make sure the electronic database that's presented as part of Obamacare that would let the most private health care records of every American go into a national database, that must never come into existence. Such information should not be the property of the federal government.
Mr. Luger, 30 seconds.
I'm very hopeful, in addition to all of that, that we'll begin to think about preventative medicine, about thoughtful care of ourselves with regard to nutrition and exercise and quality of life that makes a very large difference in terms of our need for health care later on.
All right, our next question.